Okay, hello everyone, and welcome to this month's talk. This month I'm going to be talking about falls. So, falls are an extremely common presentation in hospital settings, especially if you're working on a ward like a care of the elderly ward. A fall is probably the most common reason someone will be admitted, maybe alongside an infection. So it's something you will routinely encounter when during your placements and in your medical career as well. So knowing how to treat a fall, how to take a proper history from someone who has experienced a fall, knowing how to investigate it properly, knowing how to manage the condition, knowing how to manage a patient after they come in with a fall is really important. So today we won't have time to talk about all of those things, but what I'll quickly outline are some common causes of falls, so some potential reasons why someone might have experienced a fall. We'll talk about how to investigate it. So someone comes into the hospital, what kind of investigations do you want to do for that person? And then we'll talk about how to treat and manage these patients as well. Okay, so there are a number of different reasons that someone might have had a fall. One very common cause, again, particularly in elderly people, is actually related to medication that they're on. So one of the first things you want to always consider and review when someone has had a fall is the medication that they're on, because very often elderly people will be on antihypertensive medication. So they're at high risk of getting high blood pressure, and so they'll be on medication that reduces their blood pressure. But sometimes this medication might reduce their blood pressure too much, so they might have low blood pressure, that might make them feel dizzy, and of course that might lead to them having a fall. Beta blockers, again, similarly, might be another medication that can increase the risk of somebody experiencing fall. There are other causes, so visual disturbances. If someone's vision is poor, of course, it's very obvious how that might lead to them sort of falling down. Orthostatic hypotension is again a very, very common cause of a fall. So this is when someone gets up from sitting down or lying down, when they get up, their blood pressure will suddenly drop. And again, if the blood pressure drops, they get dizzy, they get wobbly, and they can fall. There may be a neurological cause of the fall. So if they've got a condition like Parkinson's, which can affect someone's balance, again, very obvious how that might lead to a fall. An infection is a very, very common cause of a fall as well. So if someone has an infection, again, in the elderly, that very often causes confusion. It very often leads to them being drowsy. And again, that might precipitate a fall. And of course, you might just think of something more obvious, like an environment that's cluttered. So a home that, if someone's staying in a nursing home and there's lots of stuff lying around the home, it's just a higher risk and more hazards around to trip on. So there's many different things to consider as causes of a fall, from medical causes to just things in the environment as well. Okay, so once you've spoken to a patient and got a full history and examined the patient, and you know that they've experienced a fall, what kind of investigations do you want to do for them? And there are a number of different things that you need to do as part of your workup, as we call it. The number of different investigations you want to do to rule out different things and to identify exactly what A has caused their fall, and B, what their fall has led to, as in what symptoms they might be experiencing or what complications they might be experiencing. There's a number of different things which I've listed out on this slide. So you might want to do an ECG. So this can record the electrical activity in the heart, and that can show you if there's a low heart rate, called bradycardia, or if there are any kind of arrhythmias, if there's any kind of rhythm disturbances in the heart. Again, those might have been the reason that someone has fallen. We talked about orthostatic hypotension in the last slide. So we talked about someone might get up, their blood pressure drops, and they have a fall. A lying and standing blood pressure measurement can help to determine whether or not they do indeed have orthostatic hypotension, and if that was the cause of the fall. You might also want to do a cognitive screening at the bedside. So you might want to just see what their cognition is like. Are they confused? Do they have any kind of issues with their mental faculties that might be a cause as well? So those are things you might do at the bedside. You might also want to do blood tests. So you might want to do a full blood count This can show you the white blood cells in the body, and if they're raised, that suggests an infection. And again, we talked about how an infection could be the cause. You also want to check someone's U&Es, which stands for urea and electrolytes, because if suppose someone has had a fall, and very often if someone has had a fall, people might not necessarily know and pick up on it immediately. They might be lying down for a very long time before a carer comes to check in on them, and then they realize, oh, this person's experienced a fall. They might have been lying there for hours. And that might lead to them being dehydrated, because obviously they're just lying on the floor, and they wouldn't have had any kind of oral intake or fluid intake for a very long time. And if you get dehydrated, obviously that will mess up the electrolytes in your body. So checking the electrolytes in the blood can be a good indication of whether or not someone is dehydrated or has suffered any kind of kidney injury after lying down, after falling and then lying down for a long time. You might also want to consider imaging. So suppose someone has fallen and hit their head. You might be worried about a bleed in the brain, so you might want to order a CT head, and that will show you if there's any bleeding or if there's been any kind of stroke that caused the fall. So it might help you pick up on a cause of the fall, like a stroke, and it might also help you pick up on a complication of the fall, like bleeding if they've hit their head. Also, very commonly in the elderly, someone might fall and they might fracture a bone, particularly in the hip region. So you might want to do a pelvic X-ray, and that can help. Again, obviously an X-ray can help to identify any fractures that might have occurred as a result of the fall. Okay, so suppose you've done all your relevant investigations and you've pinpointed the cause of the fall. You've pinpointed what it is that has led the person you're treating to have a fall. Obviously, the most important part of the treatment is just to treat the underlying cause. So whatever it was that led to the problem in the first place. So if it was a stroke, you'd treat the stroke. If it was an infection, you'd treat the infection. If it was vision loss, you'd obviously treat that. Obviously very important for these patients, they've had a fall, they might, especially if they've had any kind of weakness or anything, it's very important to engage physiotherapy and physiotherapists to help the patient mobilize and regain their confidence, because sometimes people might lose their confidence after having a fall. So physiotherapy is very important to establish the functionality of the patient after the fall and to try and get them back to the baseline they were at before they had it. Occupational therapy is also important, so occupational therapists can help to make any kind of adjustments in the home. We talked about having a cluttered home environment and how that might increase the risk, and occupational therapy is very important in making adjustments in the home to make it easier for people when they move back from hospital. We talked about how medications can be a cause, how certain medications can increase the risk and worsen the risk. So reviewing the medication from a medical point of view is also very important. You want to optimize the medication to ensure the patient isn't on any medication that increases the risk of falls that they don't need to be on. So really, what I'm trying to get across here is just how important it is to have a multidisciplinary approach. So you don't just want to think about this from a medical point of view. We talked about physiotherapists, we talked about occupational therapists. So there are a number of different professionals who need to work alongside the medical team in order to treat the patients and kind of get them functioning well again, so that they can be discharged from hospital and return back to whatever setting they were in before being admitted. So that's really it for this month's talk. Hopefully you found it informative, and you gained some information about the causes of falls, the investigations of falls, and generally speaking how you go about managing it. But you'll definitely encounter this during your studies and definitely during your placements as well. So it's definitely something you'll continue to build upon and develop your knowledge of. But hopefully this has been a helpful introduction to the topic. So thanks for listening.